much, and good afternoon, good evening, good morning, depending on where you are joining the Africa Climate and Health Responder course from. Welcome to today's session, session 9, National Adaptation Planning and Vulnerability Assessment. Thank you very much. Next slide. We are pleased to let you know that we have a simultaneous translation available in English, French, and Portuguese. What you need to do is go to the screen below, just next to the record or the breakout room, you'll see a globe button that shows you the interpretation. Please click on it to select your preferred language. Next slide, please. I'm really pleased to join you today. It's been a fantastic previous sessions, and we're looking forward and excited about the next sessions. Today's session will focus on national adaptation planning and vulnerability assessment, which I believe is something of interest to the participants of this course and many of us who are very keen about climate change and health. The next session will be on the 10th, on the 17th, which will focus on health service delivery and sustainability and adaptation. Next slide, please. As you know, there's a certificate of participation. Participants who have attended 8 or more of the live Zoom session and passed the final exam with a score of above 70% at the end of the course will be awarded the certificate of participation in climate change and health from this group. Please note that the certificate of participation is only available to people who use the same email. That means you must use your same email for registration as well as attending the sessions. Next slide. As you know, attendance is automatically recorded during the live sessions. Your individual attendance is only counted if you join using your personal Zoom link. Your attendance is not counted if you join using another colleague's links, as well as YouTube views will not be counted towards the attendance. I'm delighted to share that we're getting closer to when the final examination of this important program and course will be taken. Please note that the exam must be completed using the same email address used to attend the Zoom sessions. Please note and please look out for on your emails as well as on the WhatsApp group. The exam link will be sent on the final day of the class. Please take note of the date, October 22nd at 11:59 South African time, and this will also close on Sunday, October 27th. Please note that the format of the examination, as previously described in other sessions, will be 25 or so multiple choice and true or false questions. Participants should be prepared to take the exam in one sitting. Next slide, please. Today's learning objectives, particularly focused on the National Adaptation Planning and Vulnerability Assessment, aims to ensure that we can explain how vulnerability assessments are used to understand individual, community, as well as health system impact and vulnerabilities. This session will help you understand and utilize the knowledge of VNA, as well as the capacity to explore challenges faced by small and remote health systems. We hope by the end of this session, you will be able to identify the risk, vulnerabilities to critical healthcare infrastructure, delivery, as well as supply chains affected by extreme weather events and other climate impact that can be inventoried and mitigated. At the end of this session, you should be able to explain the comprehensive scope of climate and health surveillance, including health and non-health sector sources, infectious disease and non-infectious diseases, as well as looking at mortality surveillance and environmental indices. Lastly, your ability to explain and understand the importance of collaboration on information sharing across departments, ministries, agencies to support integrated surveillance as well as its benefit to individual agencies. Next slide, please. Today, I'm pleased to welcome 2 key presenters. We will be taking us through the process of a VNA assessment, and I'm also excited to learn from this. I'm pleased to welcome Sari Kovats, a PhD, who has a PhD as well as currently working in health protection research unit in environmental change and health in the Center on Climate Change and Planetary Health, London School of Hygiene and Tropical Medicine. I'm also pleased to welcome John Bosco in Isunju, who also has a PhD in disease control and currently is in Makerere University of Public Health in Uganda. Ladies and gentlemen, I'm really delighted about this session. Next slide, please. Thank you. I'm really delighted about this session and pleased to welcome this important speaker. Allow me to first of all welcome Dr. Kovats, who is the co-lead for the Belmont-funded Climate, Health, and Maternal and Neonatal Health in Africa Research Consortium. She has a PhD in environmental epidemiology, and her research focuses on methods to assess the health impact of climate change and develop evidence for adaptation options. She is also the co-lead of the chapter on health and built environment of evidence reports for the UK's third climate change risk assessment published in 2021 and the coordinating lead author for the multidisciplinary chapter on Europe in the fifth assessment report for the Intergovernmental Panel on Climate Change. Please allow me to welcome Dr. Sari for our presentation.
Thank you so much. Thank you for that introduction. So before I share my slides, I'm just going to talk about the kind of high level frameworks that we use for national kind of climate impacts assessment and how that's used to inform adaptation planning. And then several of the points that I raise are going to be illustrated by John when he presents the case study for Uganda, the Uganda National Assessment. Sorry, let me just share my slides. Right. Okay. So I'm going to try and speak slowly and not for too long because it is 40 minutes, which is quite a long lecture. I have streamlined the learning objectives because they were very broad and we'd be here all week if we tried to cover everything in detail. So I'm going to talk about methods for vulnerability assessments and why we do them, because they're really a means to an end. They are the key method by which we do evidence synthesis. So we take the research and the evidence and translate that into decision-making around climate change. And that is around adaptation planning. So that's how to manage the risks of climate change and how to ensure there is no additional burden on ill health in African settings from anthropogenic climate change. And this, because climate change affects everything, it necessarily means the health sector has to collaborate with other non-health actors and use non-health information as well. And finally, the importance of monitoring and surveillance. So to be clear, here's the outline in a little more detail. So I'm going to give a few examples and also talk a bit about the UK national risk assessment that I've also been involved with. But I have been working on national assessments for quite some time and also helped draft the first WHO guidance that was developed quite a while ago now as well. So as I said, but national assessments are a main tool for knowledge translation. So they are the kind of science part that feeds into the policy part, which is the National Adaptation Plan. But this is a cycle, so it's a dynamic system, and it's used in other kind of health decision-making, particularly around environmental health decision-making, where you have an expert panel, perhaps that's permanent or it's just convened when you need it, and they update the evidence as the evidence is updated. So in the UK, we have this as a formal process. It's actually written into legislation. There's the Climate Change Act 2008 requires that the science policy cycle for adaptation planning is completed every 5 years. And we're currently in the process of going into the fourth cycle of this, which is writing the fourth national climate risk assessment. But if the evidence, this is a very dynamic situation. So the evidence or research is kind of increasing exponentially as well at this point. So you may need to do basically update a plan or the assessment more frequently than 5 years, because so much is happening. And it's not just that there's more research being done, particularly more research, local and national research that's relevant for the national assessment. But also, the climate is changing quite rapidly. So new impacts are emerging, or new pathways are being highlighted by which climate change is affecting health. And then in theory, if you have some indicators of adaptation, so that adaptation is being implemented, then that feeds into your assessment as well. So you can see how fast the systems are adapting as well. So there are several terms for climate impact assessments. So they are used kind of interchangeably. So there is no definitive name for this type of evidence report or technical report that assesses the current and future impacts of climate change on the health of a population. But it does require population health approaches, and there are some kind of key terms I've listed on the right. So it's very important that there's a kind of basic understanding of health impact assessment methods and processes, which are kind of core parts of public health. Same with environmental burdens of disease. So it's quite important to be familiar with these kind of methods. I don't have time to go into them at the moment, but it's important that if you are considering contributing to a national assessment or developing a local assessment, that you have those kind of core skills in order to do this. The impact assessments, I've said, can also be develop over time. There can be legal processes. It may become legally mandated, and that will help frame it as well. And so, there's no kind of set in stone single way of doing this. It can be done using using the budgets available, because of course that's another limitation about how much time can be costed, and in terms of reviewing and engagement as well, the budget available, what the stakeholders want, and what the other requirements might be. And countries are at different stages, so most countries in Africa have an adaptation plan. Well, all countries have an adaptation plan, and several now have health sector specific adaptation plans, and others are planning them, and some have just completed them. So countries are at various different stages. And these documents are public. They will be on the government website, so you should be able to find them quite easily if you Google them, and you'll find that there are several different versions, and you can watch to see how they evolve over time. So there is some core guidance, and this probably the most commonly used guidance is this WHO report that was published in 2021, and this sets out 6 steps. So we will go through those 6 steps, and I will discuss each of them in detail about the sort of things that you need to include for those 6 steps. But as I've said, it's not set in stone. There are other ways of doing it. So here's, for example, is how it's done. Similar but not the same, that it was done in the UK, the risk assessment, the 3rd National Climate Change Risk Assessment. And I quite like this example because it just illustrates some of the methods. So they've obviously been through this 3 times. They're now on the 4th iteration. And each time they review back what's been done and look at lessons learned. So that informs how they approach the next formulation of the assessment. But the key thing, if you take nothing else away from this talk, is that it is a process. Process is just as important as the evidence that goes into these assessments. This is an evidence to inform policy, to inform adaptation planning. So you have to have the engagement of the policymakers throughout, and at the beginning, before you even start and put pen to paper. And this is shown clearly in an example from Uganda. So you can go through and you can see that John will talk about the stakeholders that were involved in the process. So stakeholders need to be involved, and you need to invest time as well to engage them and identify who those stakeholders are, because it's not a single stakeholder. It will be across different diseases and different health systems, and with different responsibilities. So identify your stakeholders, engage with your stakeholders, invest time talking to your stakeholders. And stakeholders beyond the health system as well. So I've already mentioned the importance of working across sectors. Some countries have actually established a cross-sectoral working group on adaptation, and that is a great vehicle for the development of these assessments. And it also ensures that the health sector assessment is consistent with other sectorial assessments. So you have sort of similar understanding of what the future climate will look like. But there are other means and processes, and countries do it in very different ways about how they set up their cross-sectoral or cross-ministerial working arrangements anyway. So there might be some kind of health and the Met services maybe working together in an established group, and that would also be key for the assessment. The stakeholders can say what they want in and what they want out, essentially the scoping assessment. And then also, obviously, also review have some input into the final conclusions of the report as well, even though it is, or it should be, an independent scientific piece of work, so very much led by the evidence. But you need ownership, and these methods, this continuous engagement is obviously essential for ownership of the final findings of the report. So other kind of more technical issues about how you want to scope the assessment is what level of governance as well. So some assessments only look at national policy, that the UK one just looks at national policy, but most adaptation is actually implemented locally, or if for federal countries, it's at state level policies. So there's already a kind of a disconnect here. So not all national policies are so relevant. So you might want to consider how you could look at the subnational focus, for example, or provide methods and tools for local health impact assessment or local climate impact assessment. We know cities kind of might do their own, a large city can undertake its own level of assessment. London does it, and that's just kind of been published as well. They've just published a big review about resilience. So they can be done at any level, essentially. But again, you've still got to have a process in place to engage the right decision makers. They've got to have a specific time frame as well. So climate change will get worse in the future. But it could be that if you're considering policies, then the policy window is actually more near term. So maybe you're targeting a policy window for the next 5 years or the next 10 years, in which case you consider those impacts that will affect policy decisions in those next 10 years. So you can consider impacts to the end of the century, but only for the decisions that need to be made in the next 5 years. So that's very much around planning and infrastructure that has a long lead time. So if you're going to build a hospital, where that hospital is, that hospital will still be around in 50 years. And then you have to consider the climate in that 50 years. I hope I explained that properly. And also which climates, are you going to go for a very extreme climate? So how do you deal with the uncertainty around the future climate? So you probably, as you need to be managing risks, you need to know what the kind of worst case scenario is. So you may want to consider looking at a kind of high level climate range, which is around 4 degrees for the end of the century, to something kind of more moderate as well. So it's very important to have a focus on the assessment, and this is the exam question that is used for the UK assessment. So it's very much around an update. So what's happened since the last assessment? So what's changed? What's different? It has to be translated into decision makers. So they highlight what's new, what's an emerging, what's a new risk, for example. And you can see on the right that we also have the stages of what the current level of risk is, what risk, how is it being managed, and then what are the further benefits of adaptation. And then we'll come back to it later, but you can see that there's 4 options along the bottom. Because one of the difficult things to do, because there's so much information, is how to prioritize. So the prioritization step is actually very key, because that helps decision makers. Otherwise, they're faced with, multiple negative impacts, and it's very difficult for them to find out what is most urgent. So I'm not going to go into what the current assessment of climate risks. I know you've all been to previous lectures on these various topics, looking at heat impacts, disasters, infectious disease, and so on. So, but it is important to use the best available kind of climate information that you have. So you use climate information from your National Climate Weather and Hydrological Service. And you talk to those experts as well, because they're the people who really understand the climate of the country or the population that you're interested in. And so it's important to consider both kind of simple and complex risks and a kind of broader range of risks. So kind of looking at the exposures and then considering how they might affect health, rather than just looking at the specific disease outcomes. And this is a kind of more complete set of the health effects that you could include within a national climate impact and vulnerability assessment. But again, that's already, each of these has a huge amount of evidence behind it. So you can see how it rapidly becomes quite a comprehensive and expensive and time expensive exercise, which is why the scoping is quite important, so that you have a framework and you can. It's much more important to do risks in proper detail with proper evidence than to do a lot of risks very superficially, because again, that will not give you the policy engagement that you need. And what evidence do we use for this? We use a lot of epidemiological studies, a lot of epidemiological information, also modelling information. There's a lot of vector-borne disease modelling that's driven by temperature and rainfall and mapping. So modelling and mapping of climate factors of distributions, as well as more kind of time series approaches to deal with heat outcomes as well. It's very important to also look at extreme events. So when there's been a heat wave or a flood or a tropical cyclone, do you have a good idea of what the health implications of those events were? And then when it comes to the adaptation assessment, you can also see what measures were put in place to deal with that extreme event and were they sufficient. It's very important to take advantage of systematic reviews and scoping reviews here. There's obviously more of these being published and they're being more targeted, because you have to be fairly focused. Otherwise, you really don't get the kind of critical assessment of the papers that you really need. But it is important to remember that context is important, especially for things like heat. Heat risks do vary a lot between, different climates, different settings. So that's why you obviously need expert judgment in order to assess this literature. So you need people with epidemiological expertise. So you can take a very infectious disease approach, a disease by disease approach, but there are other ways of looking at the kind of risks. So this is, again, an example from the UK where the risks were mapped also by pathways. So all risks to water quality and household water supplies disruption were kind of lumped together. And we looked at food safety, and then we looked at food security. So these risks also have risk owners, because they are a way of summarizing the information that's clearly targeted at specific decision makers. And if you read the full report, you'll see how they are mapped to particular stages or different policy areas, I should say. Now, these are a lot of risks. This is just one chapter. So there were over like 50 risks in the whole report, which is actually probably too many risks. And so the feedback from stakeholders was that this is actually there's too many risks for them to address. So there is a balance between kind of being very specific in terms of summarizing the evidence, but also you still got to communicate that risk to decision makers. And if you make it too complicated and there's too many risks, then that doesn't necessarily convey the message that you wanted to convey. We also looked at kind of issues outside the health sector, which again goes back to scope. So we did have a risk around the viability of coastal communities, because some communities will have to move because of sea level rise. And there are also risks where it's not clear who's responsible. Again, so for things like population movement, who is responsible? And there's always a problem in that where there's no clear risk owner, then those sorts of risks don't get addressed because they fall between the gaps between the different kind of governmental departments as well. And then the other things like competing for water, which are very important for health. also need to be addressed, which is why sometimes it's better to have a vulnerability assessment that is part. So the health chapter is part of a broader assessment along with other sectors. Then you can look at conflicts in terms of land, water, and other resources more easily. So here's another approach. This is health and environment priorities. So one way of summarizing risk is to look at the policy, the way the policies have been approached already, or where there are policies in place, because countries have already signed up to the Yewande commitment through the Environment and Health Ministerial process. So you could be, it could be easier to map your climate risk information to these specific risks. But again, this is something that will be guided by the process. So in terms of assessing future risks, there's a balance of evidence. There's obviously more evidence about current risks, and that is just as an informative. But there are some projection studies where they take a risk into the future, but there's not that many studies that basically project future outcomes. So you need to use a wide range of evidence in order to sort of make a judgment regarding what you think future risks will determine. And this obviously needs to be informed by what the future climate will look like for your population. So how hot will it get? What are the frequency of heat waves, frequency of flooding, frequency of drought? This will definitely need to inform your future assessment. But it's also worth thinking it's not just about increases in cases or changes in distribution. This, on the right-hand side, I've listed some other things that can also be considered as well for a more kind of comprehensive approach. So I guess what I'm saying is that you need to explore all the potential pathways and bear in mind that modelling only really models or quantifies a very limited pathway, essentially. So you just need to be in mind, because it's not very helpful to decision makers if you're misled by a particular paper because it only models one pathway. You need to take a more comprehensive approach, which I'm sure people understand. There's also kind of issues around scale. So global models won't be able to model some of the local features, so they're not necessarily more informative than having no modeling at all. So again, you really have to take some kind of quality assessment about how useful this type of quantitative scenario-based modelling actually is. So if we now talk a bit about adaptation assessment, so this is looking about how well we manage those risks. Because if we're not managing those risks very well, then obviously that's going to increase the impact of climate change on health. So the first step would be to look at current policies or standards or regulations, air quality standards, water quality standards, disaster risk reduction, wash availability, climate resilient wash, things like that, which of course can also be quite comprehensive. Are there any plans in terms of heat health action plans, early warning systems to manage heat risks? And then it's also important to look at about how they're implemented. So if there's any studies about levels of implementation and studies of effectiveness, so do evaluations. So once things have been implemented, do they work? Do they protect health? Do they reduce the current burden of disease? So that of itself is actually a huge piece of work. So if you're lucky, there will be a lot of that information will already be available, or it will be fairly, there'll be internal documents that maybe the government's already evaluated some of these policies. But there's other considerations as well, costs is also very important. So how cost effective are these? What are the damages avoided by adaptation? And then is it possible to also look at other benefits as well? Because people often talk about these win-win situations, and that's where you have a policy that has multiple benefits. So there are policies that a lot of public health policies that increase resilience, or social protection policies that increase resilience, and they will have direct benefits anyway. And they will also have benefits whether there's an extreme event or not, for example. So low regrets policies are very important. And then you could also consider other benefits. So there's obviously a lot of interest in environmental quality. So things like nature-based solutions are very important here. So natural flood control or putting in more trees for space cooling, they have environmental benefits beyond the benefits around cooling and flood reduction. So this is much harder. You basically need to refer back to the step around looking at future risks and then decide what needs to be done differently. So as I've said before, the framing here is quite important. So it's important to look at the policy window. Otherwise, this is a huge task. So what would be the policy window that you're recommending action or no action? Is it the next 5 years or the next 10 years? Even if this isn't explicit, a lot of decision makers basically have a very short-term focus. So it's very important to focus on decisions that need to be made in the next few years rather than in the much longer term. So I've already mentioned low regrets options, and sometimes you need to have a low regret option that just deals with uncertainty because there's too much uncertainty about what the climate may look like. So you have to have an option that is either low regret or is somehow more flexible to the future climate. And when I talked about the example of the infrastructure, that's what we call things like lock-in. So again, trying to recommend adaptation options that have more flexibility so that don't lock you into a certain path, so that a building isn't in a vulnerable place, or you don't set up a system that is somehow more vulnerable, and you have more flexibility. And then finally, there's a bit more evidence around the effectiveness of current strategies and how they are less effective under conditions of climate change. So, for example, some cooling measures may be less effective the hotter it gets. And some wash interventions may rely on there being sufficient water available, and that may not be the case. So there's quite a lot of things that could be thought about here, and there is more evidence now looking at the effectiveness of health strategies and making them more resilient, basically. But you will hear about that in the next lecture. So the final step is around the synthesis of the evidence. So this is so important. I can't emphasize how important that is, because you can research the literature, you can review it, you can write 46 pages of the best report ever. But if you can't synthesize that down into a few kind of highlights of key risks, then again, you're going to have a real problem conveying that to your decision makers. So we have on the right one method. It's not the only method. There are other methods available for the prioritization of risks. So we considered the magnitude of the current and future risk, and then whether it was currently being addressed. And if it wasn't being addressed, then that automatically increased its score. So essentially, you've got the scoring is both on the magnitude, and that's in terms of lives lost or DALYs, so population health burden, or cost, because there's cost to the health system infrastructure, and urgency, so it's a combination of magnitude and urgency, and that is how you rank. You can identify which risks need urgent action. Now, of course, it could just be that in places where there's very low capacity, then a lot of them, all the risks are urgent. And that is a very difficult thing also to address. So you may need additional criteria to consider as well. So I'm going to switch now a bit to adaptation planning, and there are lots of frameworks, health ones and non-health ones available, but they all kind of have very similar core components about the process, and that it's a kind of circular process involving planning, implementing, and then monitoring and evaluation to check that what you are intending is being implemented. And this is another framework, again, from the Climate Change Committee in the UK, but it's quite a nice one because, it just highlights the kind of various factors that go into adaptation planning. So if we start off at 1, they have a vision for a well-adapted UK. So there's a more kind of idea of where we want to be, which is quite useful because adaptation is more, or it should be really more than just tweaking policies to make them a little bit more resilient to climate. I don't know if you've heard about transformational adaptation, but, adaptation actually represents an opportunity. If you've got an interdisciplinary committee and you can get funding and you can improve environment and health aspects, so you can do more or have a kind of more comprehensive approach, I guess, than just putting in some additional policies. But it's very aspirational. And in the UK approach, you adapt to 2 degrees, but you assess the risk for 4 degrees. So you have to take into account from these more high level, high risk, high impact climate scenarios, very rapid warning, serious flooding, changes to ENSO that have these kind of more severe impacts. Obviously, there has to be a way for you to consider them as well, even if they're not that likely. And that's where you use things like national risk registers as well to kind of review what those kind of high risk, high impact, low likelihood type events are for your population, for your country or your region. And then to integrate into other policies. So I've said policy alignment is extremely important. You review what policies are already there and see if you can just add mainstream climate adaptation within them. There's no point in reinventing the wheel. Sometimes there is a benefit in having parallel structures, obviously, in order to lever adaptation, but it entirely depends on the context. You avoid lock-in, as I've said. So that means you need to reflect on any policies that are being taken in the next 5 years that have very long-term implications, so decadal issues, and worry less about the policies that can be updated fairly easily. You assess the research, you address inequalities. We'll talk a bit more about that later, but that's kind of key, the vulnerability bit in the vulnerability assessment. And you can do that formally in kind of steps 2 and 3 as well. You can ask for all your impacts, you can make sure that they're disaggregated by whichever groups that you feel are important. You can consider opportunities, and then consider whether there needs to be policies to ensure those opportunities are realised. You can understand threshold effects, so that's kind of system-based effects, which are very important, both in kind of human systems, physical systems, operational systems as well, and prepare for unpredictable extremes, which I've covered already. I'll be quicker now because I think I've only got 5 minutes left. So just to review about these, they're sometimes called HNAPs, these Health Sector National Adaptation Plans. So these are the plans that are written by or for the Ministry of Health. So the Ministry of Health has ownership and they primarily inform health sector policy. And there are lots of processes that now support this. There's particularly Attach, which is being promoted by WHO, and a lot of countries have signed up to that. But there are also other decisions as well that support these processes. So it's fairly well embedded now within ministerial policies. And then, of course, these external, the international agreements that also have some influence on adaptation, but they're not that relevant in the sense that the Ministry of Health has to own the adaptation plan. So it has to be Health Ministry led. So we did a review with colleagues in a project called MBEL. It's a slightly out of date now, so this was done a couple of years ago, but it kind of summarised what's in the national adaptation plans for countries in East and Southern Africa. So we reviewed about 14 plans, 4 of which were health sector plans. The others were kind of multi-sectoral plans. And I don't know if you could see that, but malnutrition comes up in all the plans. So in extreme weather and vector-borne diseases and waterborne diseases and diarrheal diseases are also very common. Heat not particularly well addressed. That probably is changing now. Mental health also not addressed, and respiratory or airborne diseases from air quality also not well addressed. And essentially the health adaptation priorities, you can see it here in the top row, are quite high level. So as I've said, it's a process, and these plans will become more and more refined as we move forward, and would obviously go to a place where there'll be some very specific adaptation goals, very specific adaptation targets, in the future, and very specific policies. But as they're currently written, there's a lot of kind of high level statements about improving training, improving research, improving surveillance, but they're not very specific about how to improve surveillance. So if there's not a specific action mentioned, then it's very difficult to tell whether it's been implemented or not. There's a lot around early warning, alert and response systems. There's a little bit about improving regulations and legislation, but again, very not so clear on what those details might be. But obviously, these are all core actions that do need to be done to support adaptation. In terms of high-risk groups, again, they are addressed within all the adaptation plans. And there are some actions, as you can see on this side, about how to develop your adaptation strategy to ensure these high risk or vulnerable groups are protected, sorry. And you can see there's quite a wide range of groups. Gender is very common, and there's a lot of guidance. So if you're interested in gender sensitive adaptation, there is a lot of guidance available, and a lot of work on that. It's not particularly well connected with the health objectives. It's not particularly well connected with maternal health, for example. So that's obviously work to be done there. But people with disabilities are mentioned. And if you look at a health adaptation plan, for example, in Bangladesh, they do have a lot of they're quite progressive in their gender sensitive adaptation measures and disability sensitive or disability inclusive adaptation measures. So that's the one I've read that probably addresses these things the most. So if you want an example of that, look at the HNAP of Bangladesh. So policy alignment, again, I've mentioned this before, and again, this is just a summary of some of the policies available. So not all countries have HNAPs, but they do have adaptation plans, and they do have other framework plans or health plans or resilience plans and disaster frameworks. They also have national climate services frameworks, all of which would benefit from having higher engagement around the health risks of climate change. So this is important for the adaptation assessment, because it could be that some policies are listed in these development plans or in the climate services framework, and that needs to be pulled across into that HNAP. And the more that you have a cross-sectoral arrangement or a working group to address the national adaptation planning, the easier it is to ensure that there is policy alignment rather than policy kind of disconnect. So WHO also provides some quality criteria for HNAP. So here, these pretty much covered all the items that I've already mentioned. Again, focusing on leadership and environment, enabling environment, and stakeholder ownership, cross-sectoral coordination, comprehensive and evidence-based coverage of climate-sensitive health risks, and comprehensive and evidence-based coverage of adaptation options. It talks about having a budget, which obviously makes sense to allow you to complete the processes. And it also stresses the monitoring, evaluation, and reporting. So just quickly on monitoring, there are several ways of monitoring. There's also requirements to kind of report to the global stocktake, which is part of the UNFCCC process. In the UK, they set up an independent body, which is what the Committee on Climate Change does, to monitor progress on adaptation and also on mitigation. And that was, again, set up within the legislation. But that may not always be possible. But ideally, you would want an independent body to monitor government progress on adaptation. Otherwise, the government can monitor itself. But as long as there's an explicit process or regular reporting in a public and transparent way, then that seems an important advance. There are a range of adaptation indicators, and I've just put this here because there's a lot of, without giving some specific examples, because you will have got examples from the previous lectures. But it's important to have both exposure, so what's the hazard? So that would be something like flood events, and also outcome. But outcome indicators are quite difficult. It's very difficult to get a lot of health information for some of these environmental hazards. So, looking at heat-related outcomes, they're actually not particularly well measured, for example. And malaria is maybe well measured, but it might not be measured in the way that you need it to be to understand what the climate impact has been. So it's the bottom row process indicators that are very important. So implementation of actions, things like having plans, having heat plans, having early warning plans, having health hospital level plans. Those sorts of process-based indicators become very important to understand adaptation progress, although obviously having a plan doesn't necessarily mean that it's being implemented, but it still provides some more of a picture about adaptation. There are a couple of papers that look at barriers to adaptation. Most countries are still at quite early days of having a kind of comprehensive health sector-based adaptation plan. That's all countries. But there are still barriers. If you interview stakeholders, they will say there's still a kind of lack of knowledge, a lack of translation of knowledge as well. And maybe not a lack of understanding as well about how climate might affect them in the operation of the implementation of their service, their health service. And a lack of finance is also a key barrier to adaptation. But factors that support adaptation are specific policies and partnerships, collaboration and networks and communities of practice and things like that. I think this is my last slide. So just to reiterate, the role of health sector has a key role to play between a national adaptation planning to ensure climate is considered in current health planning and to link with other health sectors. Thank you.
Thank you so much, Dr. Sari. Really interesting presentation, which leads us nicely to the next session that's going to be led by Dr. John Bosco from Uganda. I think it goes without saying that Dr. Sari has highlighted a really crucial element of how we can sustain a really strong VNA and how we can really translate this evidence into policies as well as relevant interventions across the countries. But I think it's quite important that we welcome Dr. John Bosco to really give us a perspective coming from East Africa, Uganda. Welcome to you and looking forward to your session.
Thank you very much again, Yewande. Let me just put in slideshow and straight away start. And I'm not showing the slideshow mode.
Not yet. If you want to put it in presentation mode, please.
So I'm trying to do, but it's hidden on my computer, unfortunately. Okay. No,
Are you making progress?
It's not showing the slideshow mode on all the options. So
Okay, if you want to click on the close button,
there is a button close to your slide that says from beginning.
okay, got it. It's good. All right, thank you very much again. Should be coming slideshow mode. Good.
Unfortunately, John, yeah, now you're in slide mode. Fantastic. Over to you.
I'm very sorry for that technical hitch. So members, once again, I'm just adding up to Sari's presentation to give the context of Uganda, a case where we really put this in practice and did the vulnerability assessment and followed it with the development of HNAP. This was, of course, a commitment that was made at COP26, where Uganda, like many other countries, committed to do a vulnerability assessment for the health sector and develop a national adaptation plan. So what is very important here is that you need support, both technical support, which we got from the WHO using the tools that were developed, and then the financial support. Without the funds, you cannot take off. So at that point, we were stuck with the proposals, and Rockefeller came in and supported us to conduct the assessment. So the core project team, it's very important that you have a good team that will be able to cut across environmental issues, health issues, economics, hydrology, health policy, and others. So we had this multi-dimensional team, which was able to dig in. And we had key stakeholders that were central to both the assessment and the development of the plan. First and foremost was the Ministry of Health. For me, I come from the academia, so we were supporting the Ministry of Health to develop the plan. So it was a joint team. And then we had the support from Rockefeller that kept us going and linking us to very critical partners and the technical support. But besides that, we also had a wide range of other stakeholders that I'll talk about in a few. So in selecting the geographic location of where we were going to do this study, we had to consider the risks where they are most prominent, the hotspots like the floods, the drought, the storms, the landslide. So you need to reach out to the authorities that are in charge of this. In our case, Red Cross had a lot of information in terms of disasters and the disaster database, and the Prime Minister's office. So we got this information from there, and it guided our selection. But also we looked at the various risks, climate-related risks, such as the water-related diseases, the injuries, respiratory illnesses, zoonosis, and other vector-borne diseases, to select and equitably distribute the sample. The other stakeholders that we engaged, I want just to say that I'm grouping them here under academia, and then the state actors. Those are the government MDAs, ministries, departments, and agencies, including the Ministry of Water, the National Planning Authority, the National Meteorological Authority, the Prime Minister's Office, and others, Ministry of Finance, Ministry of Health, and Ministry of Education, local government, and others. And of course, most importantly, these to be coordinated, because eventually we would have to come up with a coordination mechanism that would coordinate these government actors. Then we have a category of development partners. This would include the funders, the UN family, including the WHO and UNFP and others, FAO, and the bilateral organizations, as well as embassies, especially those who are involved in climate and health. And then we have the non-state actors, or the private sector, civil society, that include a range of all these community-based organizations, NGOs. I won't go through all of them. So these were critical in participating in the workshops, validating the findings of the HNAP, and the findings of the VAA, and the co-designing of the HNAP eventually, and of course reviewing and incorporating their different areas into the document. The assessment was done in 43 districts, and we sampled 716 health facilities, all the way from health center 2 up to regional referral hospitals. We were looking at 4 main components, or in the health system, that's looking at the health workforce, energy, water, sanitation, and healthcare waste, and infrastructures, technology, and products and the supply chain. So we were looking at how each of these hazards, how each hazard affects each of these components of the health system. How, for example, how do floods affect the health workforce? How do they affect wash? How do they affect energy? How do they affect infrastructure? And then we go to droughts, and then we go to heat, and then we go to the other storms and the other hazards as noted. We noted a few challenges, some of which we tried to come up with mechanisms of how to combat them. And these challenges included accessibility, because some places were really flooded, even at the time of the study. The bad roads, you find heavy routine workload, and then health workers may not be really available for that long time to answer all these comprehensive tools. And then how we overcame these challenges, we did prior mobilization of the participants to make sure that they save off time, and also conducting these interviews centrally. So we bring the in-charges first to the district, and we have a meeting with them and identify the most vulnerable health facilities and get some information. Then after we make a follow-up visit to the actual health facility to establish the details. Some of the data types and the data sources that we used and the challenges that are associated with doing this kind of study, picking all this information. So we needed climate moderated or health outcomes, which we could only pick from the Ministry of Health, of course. So we are now looking at the health outcomes here. We're referring to the climate moderated diseases like issues of mental health, the issues of diarrhea and malaria and others, so that we could pick from the routinely collected data from the DHIS tool. And then we had the National Disaster Risk and Vulnerability Atlas that was available from the Prime Minister's Office, in the climate country profile, climate risk country profile that we got from the World Bank knowledge portal, and then the Uganda Health Atlas from the Ministry of Health. So we had the health geographer as one of the members of the core team did us. He was very, very instrumental in providing the data that was needed. And WASH data was from the Ministry of Water. In climate change data was from the National Meteorological Authority. But there are challenges in accessing this data. You face a lot of bureaucracies. Sometimes the data is not updated, especially to do with the disasters. Not everything is captured. And incompleteness in data. We tried to keep rapport with the gatekeepers, and also you ride on the existing collaborations. It is very important that you try as much as possible to show how climate change is related to what you are talking about, or what the kind of destruction that you find, whether it's really something you can link with climate change, or it is something different, because it's clear it is important that we make a good distinction between what can be attributed to climate change and what is not. Otherwise, it becomes hazy and everything can now be blamed to climate change. A good example here is these maps down here. So the map on the left shows the normal rainfall distribution in the country, and the map on the right shows distribution of extreme events. Number of days where you have extreme events and where these are located. So the dark green areas actually show the areas that are really, really receiving high rainfall, have high rainfall at above 20 millimeters. And you can see that these areas around Kampala, the city, which is highly populated with poor drainage systems, and areas around Mount Elgon, which are prone to landslides. Then I also talk about the correlation between climate data and health data. This is an area that still needs to be explored so that we can be able to use the climate data to predict health outcomes. Here is a good example of relative humidity, comparing relative humidity in Uganda with the monthly malaria rates. You see that every time there is an increase, the blue line is showing the humidity. Every time there is an increase in humidity, it is followed by subsequently by an increase in malaria. Same you can see all across the curve, meaning that we could create models using climate data to predict health outcomes. And that way we can inform the health system and so that it responds in time, or plans and budgets in time. This is one of the core elements that we try to address in the HNAP, trying to integrate risk monitoring and early warning systems. From the assessment, we noted that a drought, floods, and storms, like you can see in the graph here, really were the most high-ranking or hazards that were affecting most of the facilities. Droughts would lead to, of course, water stress, and you know that water supply is critical for infection prevention in healthcare settings. So it affects hand hygiene, it affects cleaning routines, and also for sanitation especially where they are depending on waterborne systems. And then floods tend to contaminate water sources. So many of the rural facilities use these highly vulnerable water sources. And then the effect on the infrastructure. The floods really destroy the infrastructure, as seen here. It's one of the facilities. And then storms was also one of those climate-related hazards that ravage health facilities, because many of them are even exposed. And I think one of the adaptation measures eventually will be to plant trees around the health facilities to act as windbreakers, because they, especially those lower level health facilities, tend to be isolated in the rural areas, and winds build over a long distance eventually bring them down. We picked some important lessons from the assessment. We noted that WASH, or water sanitation and hygiene, energy services, and the health workforce were experiencing high vulnerability to the hazards above, to the floods, the droughts, and storms. And over half of the facilities that we visited lacked preparedness for droughts, for floods, and other hazards. So Sari was talking about being able to make plans, the staff being able to plan for adaptation at the facility level. So we found this is lacking, and so in building the adaptation plan, these are some of the things that we considered to make sure that we empower the health workforce to be able to make adaptation plans for the facilities, even at the lowest level, and then these can be aggregated into plans at higher levels. We also noted that engaging the stakeholders is critical, because it helps in the collaboration across the sectors, environment, health, and disaster management, and the other sectors. And it is important also to have people to hold your hand, international agencies, and both local and international, and source funding, source technical support, coordination, and others. Some of the challenges include the limited financing. Climate and health has not yet received the attention it deserves. This need for more technical support. And at the low level, there seems to be low awareness between the links with how climate outcomes link to health. We try to do as much popularization as possible, and also to engage the stakeholders to validate the findings of the VAA and engage them in the co-design of the HNAP, and also popularize the HNAP and the processes that were going both to local and international fora. So we presented these findings at COP28, and really it attracted a lot of international attention. Funders, collaborators have been coming to support different efforts. We've also had a series of planning meetings with key stakeholders locally, and including the attach training in Madrid, and the local stakeholders in Uganda. And we have been supporting the efforts in other countries like Nigeria, where they're trying to do their VAA and now at their points of developing their HNAP. It's important to have a very good communication plan so that you're on top of things, communicate with your key implementing partners, have frequent meetings, have a robust core team that is coordinating the activities, both in the field and across the different actors. And this can include be blended, be physical meetings, posters, workshops, online meetings, WhatsApp groups, etc. I think this Sari had already hinted about it. It's important to do a very thorough literature review, look at the secondary data sources and mine out this data that we could use, because most of the time the data may be available, but it's scattered in different sources. And a mixed methods approach is good, to not just go quantitative, but also to dig in qualitative and get to know why things happen and how to plan for better. When doing this vulnerability assessment, it being one of its kind, first of its kind in the region, it's very important to share this information. But sometimes, unless you get the ethical clearance, it becomes difficult to publish. So we thought that it would be important we pick ethical clearance right from the start, so that we can increase the wider dissemination of the findings, and engaging of these stakeholders was critical to ensure ownership and receive diverse perspectives. So what would be helpful for others who are embarking on developing the Health National Adaptation Plan and even conducting their vulnerability assessment? So it is important that the proposal really details the methods and approaches that will be used, the timelines and the cost, and ensure that the funds are available from the government and other partners are consolidated, and also have modalities of engaging the private sector, the banks and the other actors that are involved in climate and health space, or are willing to support this noble cause. Identify the right consultants that can do the job. Most of the time, it's difficult to isolate who will commit and do a good job, and to take keen interest in following the steps that have already been provided, instead of reinventing the wheel. So the guidance is there, the tools, as Sari presented earlier, to do this. And ensure that all these processes are linked to the National Development Agenda, that is the National Development Framework. In Uganda, we are aligning it to the National Development Plans, NDP 3 and 4, and also to the international agenda, the framework. Then we had this launch, which was a landmark launch that really left an impact. It was highly publicized on TVs. We had all these social media influencers that really it is known out there. We had several articles written about it. It's known out there that Uganda launched the HNAP, and everyone is looking out what is in the HNAP, and the popularization continues. So now I want to briefly now talk about the HNAP that we developed before we can close. So the vision of the HNAP is basically to create a responsive, adaptive, resilient health system that protects and promotes health and well-being of the people of Uganda. And the mission is basically to establish that. And we had a goal to strengthen the adaptive capacity of the health system. So we had 10 pillars, I should call them pillars or components. And these were very much aligned to what the WHO gives, but we were customized this to the context. I will not go too much in detail, but just allow me to take you through these 10. The first one is talking about leadership and coordination and governance. So this looks at all the different actors that are in there. How can we get climate and health mainstreamed? how can we get it incorporated into the planning, and who is going to coordinate the different activities? So this is where we decided to come up with a steering committee and a National Sanitation Working Group to make sure there is some form of coordination of the activities and the actors and the buy-in prioritization across the different sectors. So it's very important. Then the second one is climate smart health workforce. How do we build a climate smart health workforce? Can we go and change the curricula and update the curricula to make sure that the health workers who come out, the health workforce that are trained already have the skills, and can we have ongoing professional development for those in practice to make sure that we build capacity in planning for climate and health, in understanding the links and budgeting, forecasting, and others. The component 3 is about conducting these assessments, vulnerability, capacity, and adaptation assessments. Because what we did was only for this period of 5 years, 2025 to 2030, but there will be more assessments that will need to be done going forward. And this was a national level assessment. We will need to do more localized assessments so that we get to the detail of the actions that need to be taken. The fourth component is about integrated risk monitoring and early warning. This one looks at leveraging climate services for health. All this data that is picked from meteorology and Ministry of Water and others that can be used to model and predict health outcomes, and so that we can respond in time or mitigate in time. And the fifth component is about climate and health research. A lot of students are now reorienting, many of the students in different courses are reorienting their research topics to be relevant to climate and health. And so many grants and research projects, innovations in combating the issues of climate and health. The sixth component is about climate resilient infrastructure, technologies, and the supply chain. So the Ministry of Health is committed to putting in place resilient health infrastructure. And even the minister has been very deliberate on this. The infrastructure department was part of the process of this development of the Health National Adaptation Plan. And component 7 is about management of environmental health determinants. Environmental determinants of health. These include protecting water sources, removing breeding sites for mosquitoes, and ensuring improved air quality. Everything that climate would affect and affects health, everything in the environment that would create health challenges. As you know, health environment means health people. Even the One Health component is right here, REST, One Health approach. And then component 8 is about climate-informed programming. There are various actors that are working on different programs. One of them is mobility. The other one could be reproductive health programs, HIV, TB, so many programs that are going on, but we need to make sure that these are responding to the issues raised by climate change, so that they are informed by climate-informed health programming. Whatever programs that are going on, they need to be cognizant of the challenges and plan for the adaptation. Number 9, component 9 is about climate-related emergency preparedness and management. The disasters, the forecasting and the planning, because most of the time it's difficult to recover if you have not built the resilience, or even to respond, or even to resist. And lastly, sustainable climate and health finance. Tap into the financing streams that exist currently and other innovative ones that can come on board. So I've spent a little longer on this because it is really the gist of the plan, and the subsequent sections only break down the strategic action areas under each of the components I described. I beg not to go through all these, but the plan is available, and you can provide on soft copies online. You can just Google Ministry of Health. It is there in the repository of the Ministry of Health. So going forward, there are efforts, because after developing the plan, so what? We had to come up with a team that will ensure that the plan is actually implemented. So we have committed partners like the Clinton Health Access Initiative. We have the AMREF Health Africa, and many others like these. These are all country directors of different organizations. We have come together and formed a steering committee for the implementation of the HNAP. And out of that, we are forming also a climate and health technical working group. The first photo up there was the inaugural meeting for the steering committee. And then we are trying to leverage on the climate and health data, leveraging DHIS2 platform for climate-informed health programs. So when we talked about climate and health-informed programming, we need data. And this data can be available across different platforms. So one of the efforts we're doing is to pull, to try and integrate the climate data and the DHIS2 data, so that you can now use the the climate parameters to predict the outcomes, the health outcomes. There has also been a dialogue between the sexual and reproductive health partners who are working in that space to see how best they can handle the climate, address the climate and the health challenges that are affecting reproductive health. This group has also been mobilizing their own programs, recalibrate their funding mechanisms, make sure that they fund aspects of the different intervention areas highlighted in the HNAP. So we are looking at participation and further popularization of the HNAP at COP29. Uganda will present. It has already secured a slot with the WHO pavilion to share the lessons learned and the focus areas for the HNAP Uganda. And the ministry will also give an update on this implementation efforts. We are continuing to seek global collaboration and seek additional technical and financial support. We also want to do regional dissemination so that we reach the grassroots. We form the specific tailored actions at each the sites where the hotspots where really climate has affected, so that the adaptation mechanisms or the strategies are really tailored to target the effect on ground. And of course, knowledge sharing and best practices across the regions. and to further the efforts of resource mobilization, interest the funders, the private sector and multilateral organizations, and leverage from the membership of ATACH, which is really coordinating the global financing systems. Thank you very much.
Thank you, John. I was just about to interrupt your fantastic presentation, and not just because I wanted to, but because we have tons of questions that I think it would give both you and Sari an opportunity to interact with our participants. So thank you both once again for really bringing fantastic insights, both from the UK as well as Uganda. I believe that this is something that is of value to our learners. So I'll start with you very quickly, and just because we have 4 minutes, I'm going to insist that you both go at 1 minute, 30 seconds. So Sari, I think one of the key questions that has really come out is how can we effectively address some of those capacities for adaptation, particularly looking at future climate risk? But think of it in the context of how can we ensure that in that adaptation planning cycle, we can address issues of inequity as well as ensuring that we have fairness for the right populations. So I'll let you speak, then I'll come to you very quickly, John.
Yeah, no, that's a really important question, and there were some really good questions on that point. So again, part of the is in process. So you engage with the right communities and possibly engage with those communities or representatives of those communities if it's particular groups like people with disabilities. You will improve the evidence so we know about which adaptation measures advantage or disadvantage certain groups and ensure that that information is presented clearly within the vulnerability assessment. And then important to have, a framework to ensure that adaptation needs to be fair and equitable. And it's not just adaptation in the health sector. The health sector needs to keep an eye on what's happening in other sectors to ensure that other measures like water source development, there's a lot of adaptation going on in agriculture. Is that fair? Is that disadvantaging certain people? So it is tricky, it's difficult. I don't know any country that's doing it particularly well, but clearly there is potential to use the adaptation planning framework to benefit certain groups, who are disadvantaged.
Fantastic and really great on timing. Coming very quickly to you, John, particularly from your experience in Uganda. I think one thing that comes out clearly from the learners is climate change really affects the most vulnerable population. How can we be very cognizant of that? So from your experience, I would love you to maybe highlight how Uganda's effort was able to really focus on the climate change effect around women and children, particularly thinking about it from the LMICs, some best practices that you can share to the learners. Back to you.
Yes, thank you very much, Yewande. Yeah. So how we focused on women and children. First of all, we targeted health services that really reach out to women and children, primary healthcare and the health facilities where they go for these services. Women, we know that they're affected by malaria in pregnancy, and it has severe side effects, of course. So we really try to make sure that to see how to adapt the health system to address the challenges that malaria presents in pregnancy, and promoting adaptation mechanisms that will really curb the effect of malaria. So by targeting the various health outcomes, then the issue of water and sanitation, that really affects women and children as well. So we highlighted the vulnerabilities and suggested the adaptation measures in each of these aspects.
Really fantastic, and we are right on time. Thank you very much to the esteemed speakers that I've had on today's session. I think it's been a fantastic learning opportunity, not just for myself, but I imagine the over 1,000 experts and learners that are on the group today. Ladies and gentlemen, and colleagues who are joining into this great session, please do not forget to complete the learning survey, which my colleague must have put in the chat, and it has just popped up. So what you need to do is just pick up your camera phone or check the link in the chat, and please kindly give us a post-session survey. This gives us an opportunity to continuously improve sort of the content we provide to you, as well as ensure that we're able to address some of your questions. I believe that there's also a WhatsApp group which you can join. The link is in the chat, and kind apologies if we couldn't get onto your questions today. I believe that on the WhatsApp group, you'll be able to interact with your colleagues as well as experts on the group. On that note, I'd just like to thank you all for taking time to join today's session. Really thanking my colleagues, John and Sari, for the fantastic session. And most importantly, behind the scenes, Daniele and colleagues and Haley and Tim, who have done a fantastic job putting the session together. On that note, I'd just like to say thank you very much and have a good evening, afternoon, or morning, depending on where you're joining us from. Thank you and have a good day.
Thank you.